Okay, well, we will get started officially. Welcome to our COVID-19 conversation. This is the second one we've had in 2021, and both times we've been really fortunate to have Dr. Kiepp Talbot with us. We're excited that she's agreed to do it again because we know that there is a lot of information out there, some of it real information, some of it misinformation, but a very small percentage of any of it is fully accessible to our deaf, blind, and hard of hearing community. So we really appreciate Dr. Talbot, who is an expert in this field, making the time to be with us to address some of the myths that are out there and to answer your questions directly, anything and everything that you would like to ask tonight. So I just wanted to say, I have spotlighted the interpreter and Dr. Talbot, and in just a second, I'll turn off my own video. We will, the rest of us will stay on mute and with our videos off so that it's really easy to see the interpreter and Dr. Talbot as we do this. I'm going to be reading some of the myths that have been submitted to us and then letting Dr. Talbot respond to those. And when we finish that section, then we will open it up for questions. So if you have questions, there are a couple ways you can do it. If you're uncomfortable and you don't want to be seen, you can type your question into the chat box and we will read it out loud for everyone and let Dr. Talbot answer. But if you do feel willing to be seen yourself, then just raise your hand or type into the box, I have a question, and we will call on you and let you turn on your video and unmute so that you can sign or voice that question for everybody and get a response. So I hope you will not be shy tonight. This is a very informal gathering. Everybody's just family here, and you know at some point something technical will go wrong for us, but we will fix it, so be patient. But let me introduce very formally now Dr. Talbot, and I'm going to read this little blurb. Dr. Talbot is an associate professor of medicine in the Division of Infectious Diseases at Vanderbilt Medical Center. She's also a member of the Centers for Disease Control's Advisory Committee on Immunization Practices, and she is a member of that committee's COVID-19 work group. Dr. Talbot also performs COVID-19 and influenza surveillance for the Centers for Disease Control and Prevention. So we are very fortunate to have her experience and expertise with us tonight. And I hope you will find it really helpful. Dr. Talbot, is there anything you would like to say before we start?
Yes, there is no stupid question. This is a no judgment zone. And I don't work for the government. For anyone who has any concerns about that, I advise and I do research, but I am my own person. So feel free to ask anything that you want.
Okay, so I'm going to turn my video off so I'm not distracting anyone, but you will hear my voice just here in a second. Okay, so for the myths section, the first myth is, if I've already had COVID-19, I don't need a vaccine.
That's a great question. The more that you are exposed to a virus or a bacteria, your immune system creates better and better immune responses. So that's why when you're a little kid, we don't just give you one shot for measles, we give you 3, because each time that you're exposed, you get better and better protection. If you've already had COVID, you've made antibodies to one type of COVID. And as you well know, it's changing in their variants that occur. So if you can also get vaccinated on top of that, you'll be able to handle the upcoming variants better than if you just got sick one time with one variant. So we're really encouraging people to get the vaccine to really improve that immune response, make it bigger and better, so that you have longer protection and have protection against more of the possible variants that are coming.
All right.
And so I'm also going to add real fast, if you're worried about, oh, I'm going to get exposed to part of the COVID, well, you're going to get exposed to just a teeny tiny portion of the COVID, which is just the spike protein if you get vaccinated. And so it's not like you're going to get exposed to the whole virus again, which is nice. It's much safer. I will tell you, if you've had COVID before and you do get that shot, you may feel kind of poorly for a couple of days because your immune system has learned just enough to kind of really rev up and make you feel poorly, but that's a very short period of time and doesn't happen to everyone. So don't do it on your wedding day or the day before your wedding day. Make sure you've got 48 hours to rest and recuperate if you need it after the shot.
Okay, thank you. Another statement that has been submitted is researchers really rushed the development of the COVID-19 vaccine, so its effectiveness and safety cannot be trusted.
Yeah, I think that's a really common belief, but I think some of that is because that was the impression that was given by the media and other outlets early on. So 2003, SARS circulated and killed a large number of people in the East, like the Far East, China, Hong Kong, and Seattle, and a few other places. That virus was different in that you couldn't spread it unless you were symptomatic. So we were able to contain it and stop it. But we were very worried that that virus would come back. And so we started doing research on that virus and developing vaccines starting in 2004. So we've actually been working on a SARS coronavirus vaccine since 2004. And we learned a lot. The first few tries for vaccines were actually not good, were not safe, and they got thrown out. In that 15 to 18 year period, we were able to actually come up with better vaccine ideas, better safety, and we're able to actually do some of the models to look to see if it would actually be safer. So we were really lucky from that standpoint. Not lucky that we have a pandemic, but lucky that the pandemic that came was similar to the virus that we had seen in 2003. The other difference is it takes us a long time to develop vaccines. A lot of it is, so I'm a researcher. We think of ideas, we apply for funding. It takes sometimes several cycles of funding, which could be a year and a half to get funding. You develop this idea, you submit it. So it really takes a long time. A lot of the delays are getting funding and getting federal agencies to move forward with an idea. With COVID, we were able to say, us and many other parts of the world said, oh, you have an idea? You've been working on the SARS vaccine since 2003 or whenever you started. Here's the money, go, make it work. And so a lot of the usual timelines of applying and begging for money were actually just gone. In addition to it, scientists at the FDA have really worked overtime. Usually when you would have a review, it would take a long time, not because it necessarily took that long, but it took the number of hours and they didn't have the number of employees that were focused on that review. And COVID changed that. It became a priority. All other things were dropped and this became the priority. You do COVID and every scientist was working on reviewing the data and moving forward. So there is that misconception because we did it in a year. The name was Operation Warp Speed, which really does not build confidence. But the real fact of the matter is we've been working on this for over 10 years. And a lot of the obstacles that are usually in place were removed. So the safety checks and the safety reviews were not removed, but the obstacles to research were removed. And I think that's really the difference. And that was not communicated to the US population at all.
Thank you.
And if you're still questioning about safety, I gave it to both my parents, both my in-laws, and both my kids. So
very nice. So this is one of the big rumors that's out there. The COVID-19 vaccine can affect a woman's fertility.
This is one that no matter how much evidence we have to refute it, people have really held on to. And I think probably as a woman, and I can appreciate this, is that our fertility is almost sacred. It's a gift to be able to have kids, and it's incredibly important to all of us. And we want to know that our kids are safe too. There was someone who previously worked at Pfizer who felt like COVID was going to go away on its own and we should not develop a vaccine, who theorized that the spike protein is similar to the proteins in the placenta. And if you get the COVID vaccine and develop antibodies to the spike protein, you will develop antibodies to the placenta. And hence you will be sterile after that. That was all theory. In reality, the proteins are not similar. When you make antibodies to the spike protein, you do not make antibodies to the placenta. If you got COVID naturally, you would be exposed to the spike protein. So if that was true, anyone that actually had COVID, who was a woman, would become sterile. The other part, the next step, is that we had a group of young, healthy women sign up to be part of the COVID vaccine trials. We explained to them that because it was a new drug, that they should not get pregnant. They should use 2 forms of birth control. And they understood that. They signed the consent. They got counseled. And then a fair number of them, after their first vaccination, got pregnant. I don't think the vaccine caused the pregnancy. I think we were in lockdown and people were bored and people got pregnant. But the fact of the matter is, we know that women who have received vaccine do get pregnant post vaccination. There's been a lot of stories about irregular menstrual cycles in women. And is this due to the vaccine? And that's, part of the sterility. I think we have a lot to learn, but I think what people have forgotten is that women naturally have abnormal cycles in times of stress. And this has been an incredibly stressful period for everyone in the world, especially in the US, because people have lost jobs, have lost incomes, have not been able to pay their rent, have had family members who are sick, have had family members who would not get vaccine, or, there's been a lot of reasons for people to be incredibly stressed, especially as women. As we watch kids not able to go to school, we worry about them not being able to eat because they're not in school. So there are a lot of layers to that. So it is not surprising that some women have had menstrual irregularities that is completely separate from the vaccine. I would like to touch actually on men. COVID infection, not vaccination, but infection, causes a lot of problems with the bloodstreams, a lot of clotting. So actually, COVID infection can cause impotence and sterility in men. We don't see that in the vaccines because they don't have the same kind of clotting. So it's incredibly important, if you're actually worried about fertility and you're a man, to be vaccinated to protect those organs.
Thank you. As a follow-up, do you think that women who are pregnant now should be vaccinated? And what are the benefits or risks?
Yeah, being a pregnant woman's hard. I remember very vividly reading this book, What to Expect When Expecting. And I had eaten a donut that day, and I was reading my chapter, Being a Good Pregnant Woman. And it talked about every time you eat something unhealthy, you miss an opportunity to feed your baby. And I just remember being in tears. And really, in the big scheme of things, the one donut was not going to make a difference. But as a mother to be, you feel such responsibility for this life and this gift. And so I think we worry extra when we're pregnant. The vaccines to date have been incredibly safe in pregnant women. So we have actually, they were excluded from the original clinical trials, but we have actively searched out pregnant women who have gotten vaccine and followed them. We have found that some have had children with early deliveries or birth defects, but it's still actually a lot less than what we see in the population that's not vaccinated. What we have seen is that women who get COVID are likely to have stillbirths, miscarriage, early deliveries, mom and baby, sorry, I was just on service, have ended up in the ICU. And we've had to deliver some babies early with the hope that they'll survive because mother is dying. The American College of Obstetrics and Gynecology has reviewed the vaccines. They have brought in immunologists and vaccinologists and obstetricians and pediatricians and neonatologists, and they have reviewed all of the data. They have come out very strongly and actually kind of pushed the CDC to finally to come out also that vaccines are absolutely necessary in pregnant women to prevent the death and ICU stays that we're seeing in pregnant women and the loss of babies. The other benefit of the vaccine during pregnancy is you give your baby antibodies. So when they're born, there's a period of time where they're protected because they have your antibodies to COVID to help protect them.
Thank you. If I have had the COVID-19 vaccine, can I stop wearing my mask and taking any other precautions?
Yeah, I love that question. We were there a few months ago and I could have said yes, but the variants have changed that. If you're healthy and you're vaccinated and you're exposed, you may get sick, but you will likely not be hospitalized, will not have respiratory failure, and will likely not die. But one of the reasons we're asking you to continue to wear your mask is to protect those who are immunocompromised or who are not yet old enough to be vaccinated. Because until we can get them vaccinated, we don't want to spread COVID. And so we're asking that you continue to wear the mask so that we can continue to protect those little kids and those that have had transplants or are incredibly old and very frail.
Thank you. Another statement was that the COVID-19 vaccine enters your cells and changes your DNA.
Yeah, I wish. Not that I wish we would change people's DNA like that, but we have been trying for years to figure out how to fix sickle cell anemia and cystic fibrosis. And we have been trying to put stuff in people's DNA for years and have been incredibly unsuccessful. It is very difficult to insert something into someone's DNA. And if we could do it with messenger RNA, we'd cure a lot of diseases very quickly. Messenger RNA is what the vaccines, the Pfizer and the Moderna are made out of. We all make messenger RNA. So our cells have their little, my husband likes to call it a manual. So each cell has its own copy of DNA. And it copies the DNA with messenger RNA. The messenger RNA leaves the nucleus and goes into the cellular cytoplasm and creates protein. This is not just viral protein, this is all protein, everything that we need to survive and for the cell to survive. That messenger RNA falls apart very quickly because otherwise we'd have all kinds of proteins we don't need. I mean, our own cells would make proteins that we don't need. So it degrades really rapidly. And we know that the messenger RNA of the vaccines do also. That's why we have to keep them frozen because they just will fall apart. So you can imagine, you start warming it up, messenger RNA starts falling apart. We put it in a cell, your body's nice and warm, it starts falling apart. And then it starts replicating and making the spike protein and it falls apart. So it doesn't go to the DNA, it just falls apart. And that's why we're very comfortable using this technology. The technology has been around since the 1970s, but we've had trouble using it because the messenger RNA falls apart. So we had to figure out how to wrap it in a little bit of fat and freeze it to get it to work. And so technology has gotten better to actually deliver it. But yeah, it has no interest in your DNA. And if it did, we would cure a lot of diseases. It would be fabulous.
Thank you. We've had a few people join us since we started. So this is Nancy speaking. I just want to review kind of the format. Right now, we're sharing some statements, rumors, or myths with Dr. Talbot, and she's responding to those. And we will have a question and answer period as well. So if we get to that point and you would like to ask a question, feel free to type it in the chat and we'll read it for you. If you're willing to ask the question directly, just put in the chat, I have a question, or raise your hand and we will call on you and let you turn on your video and unmute to ask that question directly. But you can certainly be adding things to the chat if you want to in the meantime. Our next statement is that the COVID-19 vaccine was developed with or contains some controversial substances, such as the tissue from aborted babies.
Yeah, so for the messenger RNA vaccine, vaccines, they actually, original studies for original designs did use some aborted fetuses. These cells are old. We're talking 30 to 40 years ago. So they're not new aborted fetuses. The current messenger RNA vaccines are not developed or made in those cells, but some of the original design and research work did occur. And that's a real struggle if you truly believe that no abortion should ever occur. The Catholic Church has looked at this, and some other religious groups have too. The Pope feels like these vaccines save lives and should be used. The adenoviral vector vaccine, which is the Johnson & Johnson or the Janssen in the US, is manufactured in aborted fetus cells. So that is a different story. The Pope still believes that that vaccine should be used because it saves lives and is not used with a recently aborted fetus. Many drugs have previously been tested or studied in aborted fetus cells. Not that they're made, not that they're used, not that they're replicated, and not that they abort fetuses currently to do this kind of work. But ibuprofen is one of those medications. So just so you have some kind of idea, we don't routinely do that now, but there have been studies in the past that have.
So just to clarify, of the 3 vaccines available in the US, one is made in that particular way,
Yes.
but the Moderna and Pfizer vaccines are not.
Correct. Thank you for clarifying that.
So we are really to a Q&A portion now. I do have some questions folks have sent in, and I will go ahead and read a couple of those. But if you have a question that you want to ask right now live, please go ahead and put that in the chat or raise your hand so that we can call on you. But here's one question. How do we keep getting these new variants? Where are they coming from?
Yeah. So the coronavirus is what we call an RNA vaccine. And RNA vaccines are known to create mistakes in their RNA. Some of those mistakes make the virus just not viable, just doesn't live, and it doesn't replicate ever again. Some of them make the virus weaker, and some make them stronger. So some of the stronger ones are the ones that spread faster and better, or the ones that make people sicker. So we know this happens in nature. It happens at a slower rate than what we're seeing currently, because usually, like other viruses, you have some immunity to them. And so they don't grow such high titers and they don't spread so fast and have so many people to spread back and forth. When it spreads this much and grows at such high levels, the RNA has more chances to make mistakes. And so one of the things that we've been really trying to help people understand is once we slow the spread of this virus, not just here in the US, but all over the world, there'll be less variants. And there'll still be variants, but it'll take longer for them to appear, not months, but years. And so until we can really control the spread and the number of copies the virus makes, we will see a variant. And that's one of the reasons that we really want to make sure we share a vaccine with the rest of the world, because we can stop spread in the US, but as soon as someone gets off a plane from England or India or Russia or anywhere else in the world, they can bring a new variant with them. And we don't want that to happen. We want this to slow down everywhere.
All right, another question. When will the vaccine be available for children younger than 12? And do you think there are more or worse risks for children who get the vaccine?
Yeah, so whenever we talk about vaccines, we talk about risk benefit. And in the US, we really minimize those risks. So years ago, there was a vaccine that was introduced for diarrhea and kids had complications. And so we stopped it because kids do well in the US with diarrhea. We have hospitals, we have ways to treat them. And so we really had to weigh the risk benefit. We don't know the risk and benefit in kids right now. We're unfortunately quickly learning that. Kids were not in school. The kids that were lucky enough to be in school were wearing masks and sitting 6 feet apart. Most sports were canceled. Most clubs were canceled. Kids were kind of home and sheltered. So we saw some disease in kids, but now that kids are back to doing normal activities, soccer and football, and schools are in session, we're seeing a lot of disease in kids. And so right now we're trying to quickly quantify the amount of disease in kids and how sick kids get so that we can weigh that risk benefit. One of the reasons we've been slow with the kids vaccine is not just that risk benefit, but we're trying to find out the right dose. They probably don't need the adult size dose because they're not adult size. Plus their immune systems are in some ways much better than ours. Their immune systems are young and excited to learn, and they're like ready to take on a new challenge. And so they're great. I mean, so we just have to figure out that dose. There's been rumors we'll have it by December, but I don't know. And I'd rather they took their time and figured things out. That being said, though, our teenagers need to be vaccinated and the adults need to be vaccinated, and we need to wear those masks to protect those kids less than 12 until we really can figure out the best way to handle this.
Thank you. Another question. Why do we now need boosters? Who needs a booster? And what's happening with boosters?
I'm laughing because I think the word booster is my new equivalent of a 4-letter word. There's a lot that we don't know about boosters. And let me see. It is unclear who will need boosters. And if the boosters are actually a booster, like we get a flu shot every year, or if some of these vaccines we should have given more than 1 or 2 doses. So as we are seeing the virus evolve, and as we're getting more data, and as we are measuring the immune responses to the vaccines, multiple doses of the vaccines, we're coming to realize that probably some of the vaccines, like the Pfizer vaccine, should have been a 3-dose vaccine. And as adults, we don't think that way because we just get 1 shot for most vaccines. But if you remember when you were a kid, you got 3 doses of measles, and we got several doses for pertussis and several for diphtheria, because we actually had to teach the immune system how to fight a new pathogen. And this coronavirus is really a new virus. It's new to us. We don't have immunity. And so probably this vaccine should have needed 3 doses. The question is, does everyone need 3 doses? We don't know yet. We know the immunocompromised do. That's been pretty well shown. We're guessing some older adults do also. So that's one of the aspects to this. And the second aspect is, what is the purpose of our vaccination program? The big main purpose has been to prevent hospitalizations and deaths. This vaccine, after 2 doses, actually does that for the majority of the population. So we really have to decide, is that the right thing to do, since we can stop hospitalizations and death? You might still get a cold, but we get colds pretty regularly and we deal with them. The third aspect of that, in the US, only half the population is vaccinated. And we could spend a lot more time and energy helping those people with questions get their 1st and 2nd doses. Or we can go give 3rd doses to people who are willing to get vaccinated anyway and wear their mask. And so our hospitals are full of people who are not vaccinated, and it may be better to help those that are not quite ready for vaccine yet to get their 1st and 2nd doses. So I think there are a lot of questions we don't know. Currently, the FDA is meeting tomorrow with their advisory committee and it's called VRBPAC, Vaccine Related and Biologic, I can't remember, VRBPAC. You got it. And so they are going to discuss whether the FDA is going to approve that third dose in the general population or in certain populations. And then ACIP will meet Tuesday and Wednesday to say, okay, FDA approved it. How would we use it? Would we use it? What groups? Currently, the only one that has submitted and had data reviewed is for Pfizer. So the only one I think we could recommend a third dose for will be Pfizer. That's a very long-winded answer, sorry.
It was great, thank you. Can you describe what's actually happening in hospitals right now and what the associated risks are?
Yeah. So I am an infectious disease physician. The majority of my time is spent doing research on viruses. Several weeks a year, I do inpatient care, so I take care of patients in the hospital. So a week ago, I was the infectious disease physician who was doing consults for patients who were COVID positive and the teams needed help for. So I'm telling you, this is, I say all of that so you know that I've been in the hospital and I've been in the patient rooms. The hospital is full of people who are struggling to breathe. The majority, over 90% of them, are people who have not yet been vaccinated. Some we are able to give oxygen to, a drug called remdesivir, which is a new one, and high doses of steroids to suppress the immune system. And some of them do okay. The majority of them still go home on oxygen. We have some that go to the intensive care unit because they need help breathing. So we have to use higher doses of oxygen. We have to we put a machine on them that pushes air into them to keep their lungs open. Or we actually put a tube down their throat and have a machine do their breathing. Those are patients that we're giving medication to completely suppress their immune system because the virus has started a storm of the immune system. And we're trying to prevent the damage done by the virus and the immune system. Some of those patients actually develop clots in their lungs. They have pulmonary embolus. Some have heart attacks. Some have inflammation of the heart. Some have strokes. And these strokes can be in the brain. Some of them can have it in their gastrointestinal system, so their bowels infarct. Sometimes they clot off their leg. Some never get better. Some we put on a machine. To bypass their heart and lungs to keep their body alive. Some get better, but go home on oxygen. We have a fair number. I'm so sorry. We have a fair number of pregnant women. Who have had to deliver the baby early so the baby doesn't die with the mom. The staff in the hospital are heartbroken. We're losing nurses because they can't take the number of deaths that they've been seeing for 18 months. They knew they'd take care of some patients that died, but never imagined this many. We've had to move the intensive care units because those nurses are having some PTSD and trauma. And so we've had to ask other parts of the hospital to help. We're canceling elective surgeries because we don't have ICU beds. That's what it's like in the hospital right now.
Thank you. And I wish there was a way we could properly say thank you to everyone doing that frontline work and really taking care of us, even when we do a pretty poor job of taking care of ourselves and each other.
Y'all aren't the only ones. Doctors aren't good patients either.
All right, well, let me ask you something, hopefully that's easier.
Thank you.
So we are definitely seeing increases with COVID-19 and some anticipation that will worsen through the fall and winter. But we know flu season is upon us at the same time.
Yeah.
So should we be getting our flu vaccines? And is it safe to get the flu vaccine and the COVID-19 vaccine on the same day?
Yes. So great question. So last year we didn't see any flu because everyone was being good and staying at home and wearing their mask, and flu season came and left. And I've been doing this research for 20 years and saw no flu. We also saw no RSV, which is respiratory syncytial virus, which is a virus that infects babies and older adults. And actually, as of this summer, when we stopped wearing masks, we've had an RSV outbreak. So actually, the pediatric hospital is having COVID patients and RSV positive patients right now. So we anticipate if we don't go back to wearing masks this winter, we will have flu, COVID, and RSV. So highly recommend you get your flu shot. And just as a reminder, flu shots are not perfect, but they, for the most part, keep people out of the hospital, which is probably not a great place to be right now after my last question. Yeah, so it looks like they're very safe. If you have any question about it, you can go get a COVID vaccine and then a couple of weeks later a flu vaccine, or vice versa. That's okay, but they're safe together. If you're not sure, if you want to figure out which side effect is from which vaccine, because you will feel poorly, a lot of people will after COVID, it's okay to separate them, but it's also okay to do them together.
Thank you. Just a reminder to everybody that if you have any more questions, you can put them in the chat or raise your hand or write into the chat, I have a question, and we will call on you. We have about 20 minutes left for sure. I have 2 or 3 here already, but feel free to go ahead and submit more. Can you give us some examples of activities you consider to be safe right now? It's hard to stay completely home, and we've missed each other for a long time. So can you give us some examples of things we can safely do and some examples of things we should absolutely avoid?
Yeah, anything on 2nd Avenue without a mask, I don't recommend. So no bars. And I'm sure the Tourism Bureau is not happy with me, but no bars yet. They're too crowded, they're too smoky. Well, there's no smoke now, but it's still too crowded and too humid. I think most of us have a restaurant that we're comfortable going to. It's one that's not crowded. It's the one where the wait staff will actually wear their masks. It's the one that you wear your mask until you sit down and eat. I think that's very reasonable if you're vaccinated. I think outdoor activities with people that are in your bubble are fantastic. I even think it's okay to go back to church as long as you're wearing your mask. It's hard to sing with a mask on, but as my 3rd grade teacher told me, she was a missionary, that God will hear you, so it's okay, go ahead. So I think the activities are safe as long as you're wearing the mask, you're vaccinated, and you're not too crowded. So we go out and do things, but my whole family's vaccinated and we stay masked.
Thank you. All right, last call on questions, because we won't keep everybody all night if we've answered everything so well. And I do think Dr. Talbot has done a fabulous job with all of the questions so far.
And can I say, if there's a question that's too personal or we don't get time, you can email me any questions. It is quite okay.
Thank you. So I do have two more, but the second to the last one would be, what else do you think we need to know? What has someone not asked that you would really want to address today?
One. I don't know. They've been some great questions. I don't know. Ask me the next question and I'll think about it as
Okay. The last question was really, and I think in some ways you've spoken to some of this, but we use the term community very specifically when we talk about the deaf community, hard of hearing community, deafblind community. So we live every day with a very powerful sense of connection and being one group of people who love each other and exist together, experiencing the world in a very similar way. I don't think I can overstate the importance of community in the deafblind and hard of hearing world. So how do we as a community take care of each other during this time?
be kind. And I don't just mean that for the deaf community. I just think, I don't know when we started being mean to each other, but if you open up the newspaper or social media or the news, it's full of stories of people just being outright rude and mean. And I think, I guess that sounds superficial, but it's not, because we all have questions, we all have concerns, we all read different pieces of information. None of us know the right information. And I think we just need to be nice to each other and listen to each other and be patient. I just think it's really important. That to me is the emotional part that we need to do for each other. Whatever community you're part of, I think that's important. The other part, the medical part, or the emotional is medical too, but I think wearing the mask and getting vaccinated are key to protect the other people in your community, not just yourself. We have lost a couple lung transplant patients. They were vaccinated, but because they were immunocompromised because of the transplant, the vaccines didn't work. And it was loved ones who gave them COVID. It was one of them was an adult child that came to visit and gave their parent COVID. And so I think remembering that your community has a wide range of ages and health status, and that you get vaccinated and masked, not just for yourself, but for the rest of your community, is incredibly important.
Thank you. I think that brings us to the end of our questions, as Dr. Talbot has so generously offered. If you have additional questions, please feel free to send those on. We will get those to her, or if you prefer to speak to her privately one-on-one, contact us and we'll make sure you have her contact information directly. That is an incredibly generous offer from someone who's very busy in the midst of this pandemic, doing amazing work. So please don't hesitate to take advantage of that.
Please do, because I would rather answer your question or find the person who knows the answer. I won't pretend if I don't, but to find the person to answer your question who's legitimate and knows. We're not getting out of this pandemic until we all get out together. And so any question you have is worth every second of my time. So seriously mean that. And my husband also answers questions all the time. He's also an infectious disease doctor. We're related by work, but not by genetics. But if I don't know, he'll know, or I'll find someone who knows. We're really happy to do this because I want to go into the hospital and see babies being born healthily and people getting elective surgeries done because life's going to be better, and transplants and good things. Like I want to go back to work and see good things.
Well, thank you so much for once again sharing your time and your expertise and just your real generosity of spirit. I think we're really fortunate that there are folks like you on the front lines providing the care and doing the research. That's one of the things I think it's a very Mr. Rogers philosophy, and I know we've had many occasions in this nation to depend on Mr. Rogers and for this to become almost cliche. But in the darkest of times, we have to look for the folks who are the helpers. And so I think we're very grateful that people like you are helping and are giving the rest of us some ways we can help in our own small ways. I want to thank Eric for interpreting, Lucinda for captioning for us tonight, all of you for taking time out of your evening to be here to learn more, whether you were already sold on the vaccine or you are on the fence and have some questions you're trying to get addressed. I'm glad that you were here, and I hope that will help you in your decisions and your conversations with your loved ones. We have a community health day coming up on September 30th. It will be at Bridges for the Deaf and Hard of Hearing here in Nashville. We will be offering the flu vaccine, the COVID-19 vaccine, and more information about our free pharmacy program to help you manage your medications more successfully and easily and cost effectively. So please look on social media or contact us for more information about that. We would love to have you out there, whether it's for the flu vaccine, the COVID-19 vaccine, both, or just the pharmacy program. Please come and see us. Again, to Dr. Talbot, and please carry this message back to everyone else. We are so grateful for the great work that is going on. And we understand it takes a toll, but we are just really appreciative of it. Thank you to everybody. If you want to turn your cameras on for a second and wave, just to be friendly, because we love to see faces, please feel free. I'll send you all little messages. You can do that. But we would love to see you. Thank you so much for coming, for being here. And we will be posting this video so that if you have folks who weren't able to make it tonight who want to, please share it with them. We will also post a transcript of it. The captions won't record with it for reasons we've never understood, but we will do our best. So thank you all so much, and take care of yourselves and each other. Thank you. Bye-bye.